first question, hey Dr. Islam, I have gastroparesis. What is the best advice that I recommend for somebody who has gastroparesis? So let's talk about this condition. Gastroparesis is a condition in which you have delayed stomach emptying. One of the more common reasons is diabetes. So when you have diabetes, especially bad diabetes, that affects your whole entire body. You can get neuropathy, eye problems, kidney problems. But in addition, diabetes can also affect your stomach. Comment down below if you know of somebody who has diabetes or somebody who has gastroparesis. Now, this can present in a lot of different symptoms. Nausea and vomiting is the most predominant symptom when it comes to delayed gastric emptying or gastroparesis. Now, we have a couple of options we can do for treatment. We have dietary things that actually do work for a couple of our patients. What we recommend for dietary options is small, frequent meals. So what I tell my patients is that don't have 3 big, large meals. Have multiple small meals throughout the day as if you were grazing all throughout the day. The food has to be low in fiber and low in fat. This is one of the very few times I'm going to tell you to not be on a high fiber diet. Fiber and fat will end up staying in your stomach longer for these patients to cause a lot of bloating, dissension, nausea, and vomiting. So you want to be on a low fat, low fiber diet. And by doing this particular diet, small, frequent meals all throughout the day, low in fat, low in fiber, you can really help out with your gastroparesis or delayed gastric emptying. Now, we also have medical options that work very, very well when it comes to gastroparesis, and these include things like Reglan or erythromycin. We also have medications like domperidone. We also have other anti-nausea medications as well. Now, in certain individuals, these work very, very well. Sometimes they have their own side effects associated with them as well. So sometimes we have to balance the benefits versus the risk of being on these medications. But for a lot of our patients, it is a combination of dietary options and medical treatment to get them taken care of. And then lastly, we also have surgical options as well. Now, in the right candidate, not everyone, but in the right candidate, we have surgical options that can work for gastroparesis. The biggest one that we're finding out right now is one called GPOEM. GPOEM, which in essence, with an endoscope, we go into the stomach and help cut up the muscles that we think could be contracting when it comes to gastroparesis. And in the right patient, this is a very effective long-term option to help control this really debilitating problem. And so for a lot of our patients that have really bad gastroparesis, which is not controlled either with dietary options or medical options that have the right criteria to fit, we actually do this surgical procedure, which actually ends up being a very effective option for our patients when it comes to gastroparesis. Great question.